Welcome to STV National. At right now, we are in COMPURX INFOTECH PVT Limited. Now with us, Dr. Anil Visga. Hi, sir. How are you?
Hello, I'm fine, thank you.
Sir, can you brief me about your organization?
Yeah, our organization started in 2003, and our first project, which was a flagship project, was a prescription writing software. And that software was it is an intelligent software. It checks for the drug interaction for every possible, I would say, that it checks for the drug interaction, drug safety in a pregnancy, lactation, the children, elderly, as well as liver insufficiency, pulmonary insufficiency, and renal insufficiency. And this kind of software has not been developed since then by any other company. And our user must be around 20,000 all over India at the moment. Later on, we developed this prescription writing software into a tablet based also, as well as a cloud based now. Other than that, we have a complete hospital administration software, which is a cloud based. And in 2017, or rather I would say in 2013, I realized that there's a with possibility of developing a teleconsultation software, because India is a very thickly populated country, and seeing the paucity of qualified doctor, it is not possible for the government to provide healthcare in every nook and corner of the India. So teleconsultation is one modality through which we can approach to the grassroots level in the distant villages also. So in 2013, we developed a teleconsultation software on a tablet, and for 2 years, I went to my hometown in UP, district Bijnor, and started giving teleconsultation there. I used to go there for 2 days, Saturday and Sunday there, and rest of the 5 days I used to see the patient on that tablet and provide consultation through that tablet via teleconsultation facility. And somehow this was came to the knowledge of DM Tehri, that Dr. Vij has started giving a teleconsultation in district Bijnor, and so she called me, and there later on in 2018, we started teleconsultation program in 40 of the distinct villages in Tehri district, and connected them with the Burari district hospitals doctors. And then we connected the Burari district hospital to the AIMS Rishikesh for super specialized consultation. So in this way, a network was formed, and it was so successful that in 2019 we got a national award in e-governance from the Indian government. And subsequently, we had a order from Pauri district also, where we started teleconsultation. We had a order for their district hospital administration software, and that's how we kept on growing in other fields also. Now, in the Corona time, we had an idea that since patients or the doctors don't want to come near to the patients, and that way we must develop a teleconsultation kiosk where the patient independently could approach doctor and get a consultation.
The prescription for the online.
Yeah, online prescription, and without the help of any paramedic or anyone, because earlier software in that pharmacist was supposed to take the vitals and other history details from the patient and put it in the tablet, and but in this case the patient could directly sit in front of the console, and this is a teleconsultation kiosk, so he can put, it can work in both Hindi or English. So he can put his name, address, Address is not needed. In fact, name, age, sex, and phone number. And if he is not qualified to enter the complaints or his disease signs, then he can make a video or audio file of the his complaints, and just by the click of one button, he gets connected to the doctor at the periphery. He gets the notification, and then he initiates the teleconsultation. The doctor initiates the teleconsultation and then talk to the patient, ask some relevant question, whatever he needs for the making a diagnosis, and then he write a prescription and send it across, which can be printed by that thermal printer which is at the back of the cars. So the patient can get a printed prescription also for documentation, as well as he can get a prescription in his WhatsApp if he has a WhatsApp in the phone. So that's why the taking a phone number was very important. Through this, we can give him a home care tips also, because certain diseases like cardiac diseases, hypertension, diabetes, they have a what is to be taken, what you should eat, what should not eat.
General consultation.
Yeah, instructions. So that can be given as a text through that to the patient through WhatsApp also. So that, and it is also still running in the TD district in few villages. And we had a very good inquiry in this exhibition regarding this telecom.
How much it costs, sir?
This cost 1.5 lakhs plus taxes, and this is a portable teleconsultation modality, which we had been running for 40 villages. In the this comes in a backpack. Yeah, yeah, it can be taken in a backpack, and it's a mobile unit. You can, and there are certain incidences where the patient was sick, was not able to come to the doctor or the that center, medical center. So the because it was installed in the sub centers of the TD district, where only the pharmacists are there are no doctors available. So the pharmacist could take the teleconsultation kit and go to the patients. He did perform a ECG also, and that was immediately sent to the doctor at the Burari, and this way his life was saved. In otherwise, you can think that transporting the patient to the district hospital, which is almost 50 kilometers away, it almost takes half a day or something that, and the patient could die. There is an incident that one patient had a very severe pain in the scrotum. It is called as a torsion of testes, and it's so severe that if there is a delay, the testis gets destroyed. It gets gangrene, and it is for the whole life the patient can become impotent. So immediate that message was transmitted to him that he is having this kind of pain. Ambulance was immediately sent from there, and in 3 or 4 hours he was shifted to the district hospital, got in operation immediately, and that is how the life was saved. So there are many incidences in last 4 years since when this.
You will save so many lives.
Yeah, I would say I'm not me, but my at least my equipment or my facilities, and that's why we got a national award in 2019 for this project. Right, thank you. And
Are you developing in short birds for?
yeah, we are as such. I'm a practicing physician also, and seeing the need of future. As you know, the doctors sometimes have to spend 10 or 15 minutes after writing the prescription to explain what is to be taken, what is the aftercare of the disease in diabetes, what is to be taken, what is good and what is bad. And even after explaining one time, the patient again asks, can I eat this, can I eat carrot, can I eat, explaining him that you're not supposed to take any underground vegetables. He, one by one, here, that that's how the time, a lot of time is wasted in explaining these things. So we made a kiosk for that. It is called as a personal assistant, in which we have put in videos for all these chronic diseases like hypertension, coronary artery disease, myocardial infarction, diabetes, gout, or they are the cervical spondylitis, back pain, all these. Yeah, and we just instruct the patient that you go outside, take the help of a attendant there, and he would put on the video, and you can sit there and learn what is the instruction aftercare for the aftercare.
Thank you, sir. All the best.